Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Hi, welcome to the segment of Community Health Matters, Women's Health Services. We're joined here today by Serena Sauerheber, Nurse Manager at Mission Mesa Women's Health at North County Health Services. Serena has about 3.5 years of experience in women's health care at NCHS. Welcome, Serena. Thank you for joining us.
Thank you, Christina.
Can you tell us a little bit about your OB program?
Yeah, well, the OB program at NCHS really does encompass a true team-based care collaboration. We have an excellent team of OBGYN physicians and midwives that work really close together to ensure the best, to ensure really the best quality outcomes for their patients. In addition to the OBGYN physicians and midwives, we also have a variety of key team players who play a big important impact on our patients' pregnancy outcome. It includes registered dietitians for their nutritional needs, a doctor of psychology for any therapy or counseling, as well as perinatal coordinators and social workers. This unique model just really has such a great impact on the patients because they're able to have a variety of resources on site, on hand throughout their care. We also offer a variety of childbirth education classes, one-on-one and group classes throughout their pregnancy.
That's great, and that's all on site at your health center?
Yes, we have that all at our site at Mission Mesa Women's Health, as well as our other women's health locations throughout North County, in San Marcos, Encinitas, and Encinitas, San Marcos, and Oceanside.
That's great. So you service inland and coastal regions?
Yes.
Great. Can you tell me a little bit about other services that can be offered through the Women's Health Program?
Yeah, so we also offer any of the GYN services that might be needed, so any of the patient's gynecological needs, family planning services, and we're really big on cervical cancer screening, so if any of the primary care providers at NCHS need to refer their patients to us, we're able to see them and ensure that we're following the proper cervical cancer screening guidelines for our patients.
That's great. And if for any reason a patient requires surgery, any type of GYN surgery, where do you guys do surgeries at?
So if it does come to the patient needing surgery, our OBGYN physicians ensure that they follow their patients before, during, and after surgery. They work in close collaboration with our hospital nearby, which is Tri-City Medical Center, and our patients can ensure that they will be able to stay with the same physician that they've been seeing and that they're comfortable with, and they can get their surgery at Tri-City Hospital.
So can you tell me a little bit about that OB program? You talked about perinatal coordinators. What type of position is that? What do they play in the team?
So they oversee the patient's care. If there's any labs that need to be done or any particular appointments, they're really coordinating that patient's care, and they're able to check in with the patients. They do assessments on them during each trimester, and they really just see them throughout their whole pregnancy. They refer them to different resources depending on their needs and schedule their appointments with the counselors, with the dietitians, and schedule them for their group classes as well.
That's great. How many group classes are there in this series?
Well, our group classes have 6 classes, but we also offer a variety of other classes just depending on the patient's needs. We actually have a new class that's offered to prepare the patient for their hospital stay.
Oh, that's good.
And then we also have a class to orient the patients to the program.
Serena, if a patient presents at your health center and they don't have health insurance, are you still able to accommodate them?
Yes, we actually have a program resource specialist at each of our North County Health Services locations, and what they do is they help assist the patient to see what insurance they can qualify for, and if they're not able to be seen under insurance, we have a really affordable sliding fee discount program, making it really affordable for our patients.
So no one's turned away?
No.
Great. And I had a question going back to the OB program side of women's health. So when a mother delivers, how is she hooked up with a pediatrician?
Yes, our NCHS pediatricians, they do round at the Tri-City Hospital, so they ensure that our patients have that access for their newborn follow-up. So before leaving the hospital, they will have that appointment.
That's great. So, and then is pediatrics offered at North County Health Services, so they're able to continue with NCHS?
Yes, we have pediatrics in all of our NCHS locations.
Thank you, Serena. Next, we'll be joined by Katie Alvarez, our family planning coordinator, after we take a short break.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Hi, welcome back to Community Health Matters, Women's Health. We're here with Katie Alvarez, Family Planning Coordinator at North County Health Services. She's going to discuss a little bit more about the programs offered within Women's Health. Katie, thank you for joining us.
Well, thank you for having me here today. So for the programs I'm going to be discussing is about family planning services. The program that we accept is the Family PAC, which stands for Family Planning, Access, Care, and Treatment. This program provides low to no cost family planning services for low-income men, women, and teens.
Great.
There is certain requirements in order to qualify for Family PAC. These requirements are a person must be a California resident. They must be able to reproduce. So say if a woman comes in, either she's menopausal or has gone through menopause or has been sterilized, then she wouldn't qualify for the services. Another requirement is meeting the income guidelines, which is family size and their income, so either their monthly or their yearly income. And then if they don't, and then another requirement is not having medical insurance. So if they don't have medical insurance, they can qualify under this program for the family planning services. If they do have medical insurance, but if they want to keep their services confidential, then they can also qualify for it too.
Great.
And if any of the people, if they meet a requirement and they're interested in applying for this program, all they can do is either walk in or set up an appointment at any of our clinics and sign up in person, and our staff can assist them with that.
Okay. So what's covered under that program? So it sounds like it's family planning related, but say if I had a cold or a cough, would I be able to be seen with that program?
No, unfortunately, the only services that they have for Family PAC is family planning services.
Okay.
So this includes many of the different services, such as we do educational and counseling, individual education and counseling on birth control methods, the different types. Also provided under the program is all FDA approved birth control options and supplies. We also can provide emergency contraception if they need any counseling for if they need like pregnancy testing or counseling, we offer that. Another thing that we offer is basic reproductive health assessments, and then also HIV testing and treatment and counseling. And then we also do prevention and treatment of STDs, female, male, and sterilization. And that's pretty much it for the services that we offer for Family PAC.
So you had mentioned if a woman is menopausal or has had a sterilization, not able to reproduce, do you have any programs to help accommodate that woman if she needs?
Yes, we do. So we have another program called Every Woman Counts, and what this program is, it provides breast cancer and cervical cancer screenings for individuals in California for women. So there are qualifications for that as well, just like Family PAC. One is they must be a California resident. And then there's two age requirements. One is if they want to get cervical cancer screenings, they have to be either 21 or older. For the breast cancer screenings, they have to be 40 years or older.
Okay.
Another requirement is they must meet the income guidelines, and that's something that they can discuss when they sign up, and then have no medical insurance.
Great.
And then for the services that are offered under Every Woman Counts, they have clinical breast exams and mammograms, and then also pelvic exams and tests. Those are qualified under the program.
And for the mammograms, how often are those recommended for your patients?
The requirements for mammograms, it's a yearly basis.
Okay, and they start those at the age of 40?
Yes, at the age of 40.
Okay.
And that's why we have the age requirement for Every Woman Counts. That's why they have to be 40 years or older for the pelvic or the breast cancer screenings.
Okay. Great. So it sounds like you have some really great programs there at North County Health Services. How do you get the word out to the community about what you can offer and these services that are covered free to low cost?
Well, in order to educate people about our services, we do have an outreach team. So we go out to the community and we provide educational presentations on different reproductive topics, so reproductive health topics. And we also attend some of the local events. So we go out into the community. If there's a fair, like a street fair, we table at those events and just spread the word, just giving out information on the different services, not just about the programs that we offer, but just the different services that we offer at North County Health Services. And then we also do, like I mentioned, the presentations out in the community. We go to local colleges. We go to some of the schools too as well, or if there's like a community event where they do presentations, we also go out there and present to them.
That's great. Do you have any topics? I know sometimes reproductive health can be a tough topic to have conversations with teens and youth. Is there any presentations that you guys offer for parents to talk to their youth about reproductive health?
Yeah, so if we have any requests from the community asking for presentations for the parents, we can offer presentations to, talking to parents about how to speak to their teens about reproductive health.
That's great. So you talked a lot about the family planning program and just the services that are covered. I know in reproductive health, there's a lot of changes sometimes, new methods that come on the market. How do you keep your staff up to date and trained?
Yes, there is a lot of changes in family planning. So in order to keep them up to date, we do internal trainings. So you know, I can do a presentation with them to give them updates. We try to do it monthly so that way they are informed and they're up to date. So if any changes, we can inform them of those changes. And we're also always doing trainings just to make sure that all of our staff are trained and that they're able to do their job.
Great, that's really good. And how, if you don't mind me asking, are these, the couple of the programs that you talked about, the Family Pact, you mentioned a few times that they have to be California residents. Are these state-funded programs, or does your health center fund them?
They're state-funded programs.
State-funded programs. Great. Are there any other grants that you guys received to help supplement? It sounds like you have a pretty robust family planning program.
Yes, we do have another program. It's federally funded. It's called Title X. And the money that we get from this grant helps pay for some of our family planning services. So if we just like to help us for our education, for doing outreach, it helps with that part of it.
Great. So it sounds like you said you attend a lot of outreach events and you know, out in the community. What is one thing that you'd want the community to know about North County Health Services? What's the -- message that you're usually portraying when you're out in the community?
Well, the #1 message is we want to just let the community know that we're here for them, that if they need to come in and they need help signing up for health insurance, that we can assist them with that, or if they just need to come in and need assistance for, you know, a common cold, that we can assist them with that. So we're really here for the patient. We want to help them in any way that we can.
Great. Do you guys take walk-ins at your health centers?
We do take walk-ins.
Okay.
Yes.
Great. And how about if somebody is uninsured? You were talking about if they don't have health insurance, they can be seen under the family planning program. But if they do have health insurance, they can still be seen if they need to keep the services confidential.
Yes.
Great. So how is that handled or, you know, educated to the patient?
Well, when they come in and they sign up for the program, we inform them of the information that they have to fill out, and if they do have questions about that, such as if they need to keep their family planning services confidential, then we inform them that they have that option, that they can do that.
Great. Well, thank you so much, Katie, for joining us today, and we will be back after a short break.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. And that's it. If you're holding up 5 fingers or more, you probably have prediabetes. Sorry to be so blunt, but hey, you're busy. Just go to the site.
Hi, welcome back to the segment of Community Health Matters, Women's Health. I'm here with Dawn Turner, lead nurse practitioner at North County Health Services. Dawn's going to talk about more of the Well Women exams and healthy weight management in pregnancy. Welcome, Dawn.
Thanks for having me.
Thank you for joining us.
So the first thing to bring up, we do recommend Well Woman exams, and what a Well Woman exam is it's this all-encompassing exam where we do blood pressure checks, we can check, we'll do a breast exam, sometimes a pelvic exam, sometimes a PAP, we can refer for mammograms, we can talk about birth control, do STD testing, pretty much the whole spectrum, so whatever the patient needs. And the difference, during those exams, sometimes we'll do a cervical cancer screening, which is a PAP. A lot of people think they do need a PAP every year, which, the guidelines have kind of changed over the years. So it can be a little bit confusing as to the difference between a PAP and just kind of getting a pelvic exam or a regular exam. A PAP is when the provider, the clinician, goes in and actually takes cells from the cervix, and they're sending those cells to the lab to look for any abnormal cells that might turn into cancer. And usually after the age of 30, they'll start co-testing those cells for HPV. HPV is human papillomavirus. It's a STD, and it's the main cause of cervical cancer. So I like to think of cervical cancer as kind of a spectrum. So you start with normal cells, and then there's cancer, and there's this whole range in between. So from normal cells, then usually women will get HPV, and then they'll show up HPV positive, and then the HPV, if it doesn't go away and persists, will eventually cause the cells to become abnormal. Then from those abnormal cells, they'll become more and more and more and more abnormal until you develop cancer. So by showing up for your screenings every 3 to 5 years, we can catch those cells somewhere in that range before they turn into cancer. So we can even catch it as early as when it's just HPV and the cells are still normal, and then we know you're at higher risk and may need screenings more often.
When should those screenings start? I know that the age guidelines kind of changed as well.
They did, yes. They used to think when you were first sexually active, that's when you should get a PAP, but they changed the guidelines to you don't need a PAP until you turn 21, regardless of sexual history. Okay. So once you turn 21, you get your PAPs every 3 years, and then once you turn 30, we check for HPV, and then you'll get your PAPs every 5 years, assuming everything is normal. If the PAP is abnormal, then of course that would change depending on the results.
Right. And so you said the difference there, because I think a lot of people in the community still are confused because the guidelines used to be yearly PAPs, so now it's 3 or 5 years. How is that education with the patients? Because it's so important to get them in, like you said, on an annual basis for a well woman. So kind of how does that education go with your patients and explaining kind of that difference?
That is a confusing thing, that women come in and they're expecting to get their PAPs, and then you kind of explain to them, well, we'll just do a well woman exam today, and you don't need your PAP for another 2 years. So I try to explain it, same thing, kind of along that spectrum, where even if we're waiting 3 years or 5 years, depending on your age, it still hasn't turned into cancer. You know, we're still catching it early enough, and that's usually reassuring to them. And the reason we did it yearly before is we just didn't have enough research to show that, okay, we could wait 2 years, we can wait 3 years, 4 years, depending on HPV status and things like that. We usually wait till 21. A lot of parents will come in and bring their kids saying, oh, you know, they're sexually active now, they need their PAP, and the kid is terrified. But we just explain to them that a lot of times when you're younger, less than 21 and even less than 30, a lot of people will get HPV, but they can actually clear it on their own, and they don't need, you know, what would happen if we screen them too early is we would find the HPV, put them through all these tests, colposcopies, things like that, biopsies, unnecessarily, when they would have just cleared it on their own if we left them alone.
Okay. Is there any type of vaccination that can help prevent the HPV virus?
Yeah, great question. The Gardasil vaccine has been out for about 10 years now, maybe even a little longer. We usually vaccinate kids around 11 years old, and it's for boys and girls. And that's because girls are getting HPV from boys too, so we vaccinate them even though they can't get cervical cancer, of course. So we do recommend getting the vaccine before you become sexually active so that it works. And hopefully, you know, once more and more data comes out, that will decrease or ideally eliminate cervical cancer when you're older.
Great. And at your health center, North County Health Services, are you able to give that vaccine on site?
Yes, we do. It covers 9 different strains of HPV, so we have it for all the kids. You could pay out of pocket for it if you needed to, but most insurances will cover it up until the age of 26. So we do recommend, even if you come in when you're 18 and you never had vaccines when you were a kid, we can still give it to you at that time, or 21 or 22, and get you covered. And even if you've been sexually active already, it does still protect you from getting HPV in the future.
So you had talked about these well woman exams, so women are still coming in yearly to receive checks and do blood pressure. What if a patient at that time presents with a positive pregnancy test? How does that work in your health center?
Well, as I mentioned earlier, we do have a great OB program. So what we can do, we have OB-GYNs and midwives at our Encinitas Center, and it's very easy. We find out they're pregnant, we give them the news, we give them all their different options, we kind of talk to them about prenatal care and starting prenatal vitamins, and then we can actually get them set up for an intake appointment, and we can get them set up with Medi-Cal if they don't already have insurance, because once you're pregnant you do usually qualify for Medi-Cal right away, and then we can get you an appointment with one of our midwives or OBs or whatever the case may be right away, right in the same health center, so you don't have to go find another doctor or wait for a referral or anything like that. So it's a very nice, easy transition for them.
That's great. What if a patient that you're seeing either maybe before she becomes pregnant is having issues with, you know, weight management? How do you work with your patients and educate them on the importance of weight management, especially before pregnancy?
Yeah, weight management has become a big issue, I think, in the U.S. You know, 1/3 of adults are obese or overweight. And a lot of people don't realize, you know, they think during pregnancy, oh, it doesn't matter, you know, my weight doesn't matter, I can eat whatever I want. I'm eating for 2, everyone says, yeah. But really eating for 2 doesn't mean you need to eat twice as much. So what happens is if you gain too much weight during pregnancy, you actually put yourself at risk for gestational diabetes, which is diabetes during pregnancy, stillborns, preterm birth, large gestational age infants, which when you have a larger baby, you're more at risk for complications during labor and delivery. You're also putting your child at risk for childhood obesity, congenital defects, and all sorts of things that people don't generally think about when they're pregnant, that their weight can have such a big effect. So usually we recommend, if you're a healthy weight going into pregnancy, gaining a normal weight gain would be about 25 to 35 pounds. Whereas if you're underweight, of course, you'd want to gain a little more, closer to 28 to 40 pounds. And if you're overweight, you'd gain about 15 to 20 pounds, or 15 to 25. And then obesity, you really only need to gain 11 to 20 pounds. And most of that weight is gained later in pregnancy. During that first trimester, you really only gain about 2 to 4 pounds in those first 3 months, which is not a lot. And then every month after that, most people gain about 3 to 4 pounds. So most women only need about 300 extra calories starting in the second trimester for a healthy pregnant weight. And 300 is not as much as you would think.
For two.
Yeah.
About one yogurt. Or
yeah, exactly.
So, that's great. So you had talked about if patients diagnosed with gestational diabetes during pregnancy, are they able to remain in care at North County Health Services, or do those patients have to transfer elsewhere?
Yes, we actually do have a great gestational diabetes program where we can follow you, check your sugars closely, talk about insulin, do all of the diabetic education. And the nice thing about NCHS is you can transition really easily once you deliver back into primary care, where they can continue your screening for diabetes or treating your diabetes depending on how your sugars are after delivery. And you can it's just a very easy transition back and forth from being pregnant to, going back to your primary care prevention.
That's great. And at your health center that you're the lead clinician at in Encinitas, what service lines do you offer there?
We offer family practice, internal medicine, women's health, pediatrics. So kind of like they mentioned earlier, you can get your new baby right into pediatrics from the hospital, and then you can come over to family practice and primary care and not have to go anywhere else.
That's great. Definitely like a medical home, and
yes,
sounds like you're really there for your patients and provide great education.
Yes, we try.
Good. Well, thank you for joining us, Dawn. For more information on services at North County Health Services, you can visit nchs-health.org. Thank you for tuning in, and we look forward to seeing you again.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.